Okay, guys. So we talk about three factors of gum disease. We talk about the what. We talk about the why it happened. We talk about the why it's important. Now let's talk about how it need to be treated. How do you treat gum disease? Remember, there's no cure for it. Once you have it, it's a lifetime commitment. You have it for life. But it's very treatable. Okay? So, how do you treat it? You get scaling and wood planning. It's called SRP, scaling and wood planning, or it's called gum therapy. I numb your mouth and I scrape the hell out of it. I scrape all the plaque. And trust me when I tell you I scrape them out, I scrape them out. If you all come and come see me, you'll see for yourself. There's certain things I can't explain to you, but I do scrape that bacteria out of your mouth. And depending on the level of the disease, I will send you to see the gum specialist. Okay, because there's certain level you have to see the gum specialist, because if you don't see the gum specialist to see if everything was able to come out on the scaling and wood planning or deep cleaning, then you might come back to see me in 3 months and then your mouth is still bleeding all over because the bacteria is not stabilized yet. And then I flush it with antibacterial medicine and the doctor do the laser, or you get some antibiotic done on the mouth. Not something you drink, it's something that the hygienist go on the side of the infection and place it there. And after that, you go every 3 months for your periodontal maintenance. How long do I have to do that? For the rest of your life. There's no going out there. The bacteria, how does it form? What happened? When you get, every time you get a procedure done, every time they do a treatment for you, once you leave the office, the bacteria is already started coming back. So now, in 90 days, the bacteria is at the peak of their formation. That's when the bacteria is about to cause a lot of damage. That's when you need to go back. When you go back to see the hygienist, the hygienist clean below the gum for you, flush it for you, and send you home. That's why it's important that you go every 90 days to see your hygienist so that the hygienist can take care of anything that you couldn't take care at home, so that you're not losing any bone. As soon as there's bleeding, that's when there's still active bacteria in your mouth. So then as soon as there's active infection, and you know what happened. If you have infection, you know what's gonna happen. Infection, inflammation. So as soon as it's active, it's gonna keep causing more bone loss. And the more bone loss, the more closer you are from losing your teeth. Okay? Okay, guys. If you have questions, don't hesitate to ask. And next time, I have a very important subject to talk to you about, and it's not about gum disease. I promise you that. Now, ciao.